Welcome back to the deep dive. Today, we are focusing on a system that is, well, it's just fundamental to every single moment of your existence. The respiratory system.
It really is.
I mean, you breathe, what, something like 20,000 times a day, and you probably don't give it a second thought. But this isn't just about moving air.
Oh,
We're going to dive deep into the incredible mechanics of this system. It keeps you alive in four really distinct ways that go so far beyond just breathing in and out.
that's absolutely right. Our sources really confirm that if you view the respiratory system as just a gas exchange machine, you're missing at least half the story.
Right.
So our mission today really is to help you appreciate its huge systemic impact. Specifically, its massive and kind of non-obvious role in keeping your body's entire internal chemistry stable, that thing we call homeostasis.
So we're looking at a system that's part pipeline, part chemical plant, and part high-efficiency filtration unit.
Precisely. If you break it down, the system is our oxygen supplier and our Cushioro remover,
Yeah.
of course. But it's also, and this is so critical, our pH balancer and our speech maker.
Okay.
So to give you the full picture, we're going to follow the path of a single breath. We'll start in the upper tract, the prep and defense zone, and then move down into the lower tract, which is like the high-efficiency engine room where all the real chemical work gets done.
Let's start with those non-negotiables then, the primary gas exchange, because I think understanding that leads us right into the system's most fascinating job.
It does.
We breathe in oxygen. It diffuses from these tiny air sacs, the alveoli, into the blood, where it latches onto hemoglobin and then just races off to fuel all our cells.
And on the flip side, you have the metabolic exhaust, the CO that the cells make as they burn energy. That gets dumped right back into the bloodstream. It travels back to the lungs, moves into the alveoli, and you breathe it out. It's a constant push and pull.
But the CRO, it's not just garbage waiting for pickup, it's a major chemical player. And this is where that function of acid-base balance really takes center stage.
This is, I think, where the lungs truly show their importance beyond just, getting oxygen in. When co-rose dissolves in your blood, it reacts with water and it forms carbonic acid.
Okay, so more co-rose means more acid.
Exactly. More acid, lower pH.
Mhm.
And your body is incredibly sensitive to this.
Oh.
It needs the blood pH to stay in this remarkably narrow range, 7.35 to 7.45. Any deviation, it's extremely dangerous.
So if your body starts making too much acid, say your pH drops below 7.35 acidosis, how fast can the lungs actually react to that compared to other systems?
And that is the key. They are the rapid response team. The kidneys are also involved, but they take hours, sometimes days, to really ramp up their action. The respiratory buffer system, though, it works in minutes.
Wow.
If your blood gets too acidic, receptors sense that increase in co-erose and acid, and they immediately signal the body to increase the rate and depth of your breathing.
So by breathing faster, you're sort of intentionally hyperventilating to get rid of the body's acid.
That's exactly. You are rapidly blowing off more co than you normally would. And since you're removing the source of the acid, the blood pH quickly starts to rise back toward that sweet spot of 7.4.
And the opposite is true too then. If your blood gets too basic, you'd slow down your breathing.
You'd slow down, breathe more shallowly, all to hold on to that CO and lower the pH. It's a brilliant, immediate mechanical feedback loop that's managing this incredibly complex chemical state.
And you can feel this when you exercise, right? Your muscles are producing lactic acid and your breathing just instantly speeds up to help manage that sudden acid surge.
It's the ultimate preemptive chemical strike. And speaking of using air mechanically, let's touch on that fourth job, speech. It's sort of a necessary secondary function that's built right into this system.
Right. The air moves through the larynx, the voice box, and that air makes the true vocal cords vibrate, which creates sound waves.
And at that point, they're just vibrations. The really complex work of forming words, creating tone, that's all done by everything above the larynx. The pharynx, your tongue, your lips, teeth, palate, they all shape those sound waves into language. It's amazing that the same structures that protect our lungs also let us create poetry.
So now that we know why we breathe and what it does for us chemically, let's follow that air down the defensive highway. Let's get into the upper respiratory tract, our body's own environmental conditioning system.
Okay, so air enters the nose. And the nose is basically our body's filtration and climate control unit. It immediately hits the conchae or turbinates, these like little shelf-like things inside your nasal passages, and they're full of blood vessels.
That rich blood supply serves a very specific purpose, right?
Yes, absolutely. It is designed to rapidly warm and moisten that incoming air. You want it at body temperature and 100% humidity before it ever gets to the delicate lower airways. Cold, dry air can be really irritating.
And you have the hairs and mucus for the first layer of filtration.
Your first line of defense.
I find the paranasal sinuses fascinating, these little cavities.
Mm.
What's their primary role beyond just making your skull lighter?
Well, their main functional role we know of, besides drainage, is acoustic. They're empty chambers that add resonance to your voice. They give it depth. I mean, just try speaking with a bad head cold. You realize pretty fast how important that resonance is.
Right. Okay, so the air is now conditioned. It's filtered of the big stuff. But what about the microscopic things? Dust, bacteria, smoke. This brings us to a really sophisticated defense mechanism, the ciliary escalator.
This is so crucial. The airways are lined with this special tissue that has millions of tiny hair-like projections called cilia. And it also has these goblet cells that produce mucus.
So the goblet cells put down this sticky mucus blanket.
Exactly. It's like flypaper. It traps all the tiny foreign particles and pathogens. And then the cilia, these little hairs, they start beating in this rhythmic way, sweeping that entire mucus blanket upward toward your throat.
So it's a constant self-cleaning conveyor belt.
It is. It's moving debris out of the lungs and up to the pharynx, where you can either swallow it or, cough it out.
We have this really sophisticated system, but our sources are pretty clear that it's alarmingly vulnerable.
It's very fragile. Smoking, for instance, just devastates ciliary function. And chronic irritation can actually cause those specialized ciliated cells to be replaced by tougher, non-ciliated cells.
And when that happens, the escalator just shuts down.
It shuts down, and all that debris and mucus just sits in the lungs, which exponentially increases your risk for chronic infections and disease. It's the price you pay for firing your body's essential trash collector.
Let's move down a bit through the pharynx, the common tube for air and food, which is, where we get a sore throat. But the real star of mechanical protection down here has to be the epiglottis.
Oh, the epiglottis is our crucial little switch. When you swallow, it just automatically flips down to cover the opening of the larynx, which is the gateway to your windpipe.
So it's making sure food goes down the right pipe.
Yes, it routes food and liquids safely into the esophagus and away from the lungs, preventing aspiration. That split-second timing is it's non-negotiable for survival.
And the larynx itself, with the Adam's apple, it also helps protect us because the vocal cords slam shut when we swallow. It's like double bolting the door.
It is. And we should also talk about the risks up here. The pharyngeal tonsils, or adenoids, they're defense nodes. They swell up when they're fighting something.
Right.
But if they become chronically enlarged, they can completely block the nasal passage.
Which forces you into mouth breathing. And why is that so much worse for you?
Because you completely bypass that whole conditioning system we just talked about. The air hits your lungs cold, dry, and unfiltered. And that not only irritates the lower tract, but it can lead to dry mouth, which increases your risk of dental problems. It messes up the whole system.
And as a final point on the upper tract, there's that connection, the Eustachian tubes between the nasopharynx and the middle ear. That explains why a simple cold can so quickly turn into a painful ear infection.
The systems are incredibly interconnected, even though the lungs themselves, where we're going next, are kept as a sterile environment.
That brings us into our final segment, the lower respiratory tract. We've left the filters, and now we are entering the engine room. We're in the trachea, the main windpipe, held open by those rigid cartilage rings.
And the trachea splits. It bifurcates into the right and left primary bronchi. And this junction is really important clinically. The sources all point out that the right primary bronchus is anatomically wider and straighter than the left.
Why does that detail matter so much?
It's a key clinical detail. Because it's a straighter shot, if you accidentally aspirate something, a piece of food, a small toy, it is statistically much, much more likely to end up lodged in the right lung than the left. It's just the path of least resistance.
As the bronchi keep dividing and getting smaller, they turn into these tiny airways called bronchioles. And this is where the structure changes, right? The cartilage disappears.
It completely disappears. And that means the diameter of the bronchioles is controlled exclusively by a band of smooth muscle that's wrapped around them. This is what controls airflow resistance.
So when you need more air, like during exercise,
That smooth muscle relaxes. It's called bronchodilation, and it maximizes your airflow.
and the flip side is the problem, like in an asthma attack, that muscle constricts too much.
That's bronchoconstriction. And without cartilage to hold the airway open, airflow gets severely restricted.
So the air keeps going down this branching tree until it finally reaches the millions of alveoli, the tiny air sacs. This is where the gas exchange finally happens.
And they're just enveloped by this dense web of capillaries. They're designed for maximum contact.
So it's all about surface area.
It's architecturally perfect for it. The layer separating the air inside from the blood outside is called the respiratory membrane. It is unbelievably thin, so thin that gases can diffuse across it in just milliseconds. It makes the whole exchange lightning fast.
But even way down here, you still need a defense mechanism. What if a particle makes it all the way down?
That's the job of the alveolar macrophages. Think of them as the deep-sea divers of your immune system. They just patrol the alveoli, cleaning up any dust or bacteria that somehow slipped past all the other defenses. They are the final cleanup crew.
But the real functional miracle of the alveoli, the thing that keeps them working, has to be surfactant. What is it doing chemically?
Okay, so think of it this way. The inside of the alveoli is lined with a thin film of water. And water has high surface tension. It wants to stick to itself. If they were just lined with water, they would collapse completely every single time you exhaled.
Like a wet balloon deflating and sticking to itself.
Exactly. And the next breath would be incredibly hard work. So surfactant, which is made by special cells in the alveoli, it's basically a detergent. It dramatically reduces that surface tension, which prevents the air sacs from totally collapsing when you breathe out.
So it keeps them slightly open, primed for the next breath.
Primed and ready to go. This is why a lack of surfactant is such a massive problem for premature babies.
Let's pan out to the lungs themselves. We know they fill the chest, flanking the heart.
And that placement dictates their whole structure. If you look at them, the right lung has 3 lobes, but the left lung only has 2. And that's entirely because the heart takes up space on the left side in the area we call the mediastinum.
And the tissue itself has to be incredibly flexible.
It's mostly elastic tissue. That elasticity is vital not just for expanding when you breathe in, but for the passive process of recoil when you breathe out. Healthy lungs just snap back into place like a stretched rubber band.
And finally, we have to talk about the mechanical secret that actually forces the lungs to expand the pleural system.
This is one of the most brilliant design features in the body. Each lung is wrapped in this double-walled membrane. Between the 2 layers is the pleural cavity, which is filled with just a tiny bit of fluid.
So the fluid lubricates things so they can slide.
It does that, but its main job is cohesion. The pleural cavity maintains a slightly negative pressure compared to the atmosphere. And this negative pressure plus the fluid, it acts like 2 wet pieces of glass stuck together. They adhere.
So when your diaphragm and ribs expand the chest wall?
The negative pressure forces the lungs to stick to the chest wall and get pulled open along with it.
So the lungs don't actively pull themselves open, the chest wall pulls them open because of this adhesion.
Precisely. It's a passive but forced expansion. And if you lose that negative pressure, like from a puncture wound, the adhesion breaks, the lung collapses, that's a pneumothorax. That pressure dynamic is everything.
Wow, that whole system is just a masterclass in elegant design. So what does this all mean for you, our listener? If you take 3 things away from this deep dive, make it these. First, your respiratory system is vital for minute-by-minute survival, not just for oxygen, but because it is the fastest regulator of your blood pH. Second, that mucociliary escalator is a necessary, sophisticated defense mechanism, and its fragility is a major factor in respiratory disease. And third, efficient breathing depends entirely on crucial mechanical bits like surfactant to prevent air sac collapse, and that negative pleural pressure to make sure your lungs expand every single time.
And this raises an important question for you to think about. We've seen how structures can serve these dual essential roles, right? Balancing immediate survival with other complex functions. The vocal cords make sound, but they also stop you from choking. The sinuses make your head lighter, but they also give your voice resonance. So think about that interplay of purpose. What other systems in the human body can you identify that serve both a profound life-preserving need and an equally important social or structural function? It really makes you reflect on how often biology manages to kill 2 birds with 1 evolutionary stone.